Hello, I'm Nicole Klaus, and I am a psychologist here at KU School of Medicine and a member of the Sedgwick County Suicide Prevention Coalition. And we know that residents, physicians, and medical students have higher rates of burnout, depression, and suicide than the general population. And suicide rates have been increasing across the country over the last several years, making suicide the second leading cause of death among 15 to 34-year-olds. And right here in Sedgwick County, over the past 10 years, we have lost more than 35 healthcare providers to suicide. And even one death is too many. And physicians are not known for being good patients or taking good care of themselves. And physicians and trainees are less likely to seek mental health treatment when it's needed. And so, as a society and a professional community, it is more important now than ever to foster awareness, reduce stigma, and promote a culture of self care and help seeking. And that healthy self care can start by practicing and modeling taking time off, engaging in relaxation with family and friends, or setting healthy boundaries by allowing yourself to say no, and by recognizing warning signs that you or a colleague or a student might be at risk for depression or suicidal behaviors. And so we can think about warning signs in terms of a person's thoughts or communications, in terms of their behavior and in terms of their moods. So some things to look for in thoughts or speech might include feeling trapped or feeling like a burden on those around you, and feeling hopeless or like there's no reason to live. Behavioral warning signs might include using drugs or alcohol more often and engaging in other kinds of reckless behaviors, having changes in sleep patterns, or looking for ways of harming or killing oneself. And finally, moods to be aware of include increased depression, irritability, anxiety. And if you have concerns about any of these risk factors in yourself or in a colleague, it's important to get help. And that starts with being willing to talk about it and to ask the question. You can say, hey, I'm concerned about you. How are you doing lately? Have you had any thoughts about hurting yourself? And then it's important to get help if you're still concerned. Here in Kansas, the Kansas Medical Society has a professionals health program that is tailored to the unique needs of physicians and trainees, and is a great resource. Because we know that unaddressed stressors and mental health conditions are much more likely to have a negative impact on a professional's reputation than seeking help early. And the highest quality of patient care starts with a healthy and resilient healthcare provider.